Imagine you just got in a car accident, or a loved one collapsed in front of you. A scary thought, but in these moments, many of our first thoughts focus on getting help as soon as possible. So when you call 911 and talk to a dispatcher, you hope that you are about to receive the best or at least the quickest care possible, right? Well, this is not exactly true. Volunteer ambulance squads were designed to provide safety and responsive care to their community. However, in the past couple years, with budget cuts taking over, a short supply of labor, and now with many providers burnt out or sick with infectious diseases like Omicron, volunteer ambulance squads have been forced to rely on each other, juggling their responsibilities chaotically by reaching out to surrounding towns when they have a lapse in coverage, often delaying patient care by up to 30 minutes. As a provider, this issue was eye-opening to me in a field where every second mattered. With over 240 million ambulance calls in the U.S. every year, many in rural areas where volunteer ambulance squads have struggled without any federal or state-level guidance that could help address their resource problem, for-profit ambulance companies have stepped into their place, thus forcing some insuranceless residents to gamble with their safety as a trip to the hospital is often accompanied with debt. Seeing this grave issue, as a group of community-involved students who have parents with health issues, we were inspired to create AmbShare this weekend. Our platform is based on optimizing ambulance matching for patients, which speeds up arrival times. While this sounds a lot like Uber for ambulances, there is much more to our startup. We are looking to bring out the next generation of providers, allowing us to send child specialists to pediatric calls, as well as mental health specialists where needed. But as a whole, we are looking to provide volunteer-based towns with the ability to pool their resources and optimize their processes, getting patients to hospitals faster where they can get the care that they truly need. Ultimately, our cooperative system aims to decrease the operating cost of ambulances and decrease provider burnout caused by years of long shifts without rest, while providing patients with a new standard for quality of care. We plan on implementing this idea strategically by using Bergen County, the most populated county in New Jersey, as a starting point. There, volunteer ambulances have taken over half the county 911 call volume, allowing us to integrate the last but most important component of our startup, soft billing. By automating soft billing processes for volunteer towns, we can generate a completely new revenue stream for these municipalities, while ensuring that no community members have to pay out of pocket for the care that they so desperately need. Inputting patient data and submitting invoices would be as easy as the click of a button, since we have designed an iOS app that could be melded with patient care reports. While competition does exist in the form of city agencies who have innumerable resources, however, they fail to address the countless Americans who live in suburbs and rural areas who rely on volunteer ambulances. In fact, with a $50 billion market and operating on a commission principle, we are inviting to both large and small-scale towns with nothing but room to grow. With a team of health-focused minds, we plan on disrupting the future of emergency medicine.